but we like to be clear, PMDD and PMS are not quantifiably the same thing. They're not the same diagnosis, and I think for a long time they really got treated the same way. So, if we wanted to kind of define the two or separate the two, right?
Yeah, let's start with PMS.
Yeah. So PMS, most patients are going to be familiar with premenstrual symptoms, and that may be identifying, the physical characteristics, right? The bloating, the cramping, the discomfort. And certainly there is a mood component or a subjective symptom that goes with it as well. Volatility in moods, changes in sense of well being, agitation, and things like that. And I think, and Tiffany, you may have a different experience. I think for a long time, and the reason that kind of the differentiation between PMS and PMDD is so important is what we're finding out now is a lot of these PMDD cases are patients that have been inappropriately diagnosed with PMS. And then some of the traditional PMS interventions have been not only not helpful, but actually deleterious as far as an outcome standpoint. So,
I think we have to acknowledge also that PMDD does have a mental health component, which I feel like has been more researched here recently.
yeah,
So there's a little bit more of the psychiatric end of it that you're seeing.
yeah, and I think the PMDD that would be, probably where the biggest differentiation between PMS comes in. It is a mood, it is a psychological disorder, but it's really extreme, right? So, for example, this isn't I'm agitated or I'm irritable. This is I'm irrationally mad. I'm
I think they
uh
qualify it as rage.
yeah, I so yes, rage. I'm having suicidal ideation 1 to 2 weeks out of the month. Um
Incredible depression, like can't pull yourself out of bed, can't think straight, can't do anything.